This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Whether it's related to exercise injury or just the aging process, at some point we all deal with joint pain. Here to help us understand those aches and pains and how to treat them, we welcome from Providence Dr. Andrea Buckler. Hi, Dr. Buckler.
Hi, thank you for having me.
Well, my pleasure. So talk to me about some of the most common problems, joint problems that you're seeing with your patients.
Sure, we see a lot of hip and knee pain, mostly because they're the weight-bearing joints, and so they tend to see a lot of stress over the years, depending in particular what activities patients participate in, but the hip and knee are probably the two most commonly seen.
Okay, and are those caused by injuries, or what causes joint problems?
There's a wide variety of things that cause joint problems. There can be an acute injury such as a meniscus tear or an ACL tear in the knee, or you can have more of a chronic overuse type of injury and ultimately arthritis for some patients over many years. That can be an accumulation of small injuries, or just sometimes there's genetic components to that stuff.
Okay, so you see joint problems with all ages?
All ages.
So even kids have joint problems?
Absolutely. We start seeing joint problems sometimes in teenagers with muscle imbalances. Some of our teenagers who are pushing really hard in sports, competing at high levels, playing year round, they don't get a lot of breaks. And that's hard sometimes, especially if they've grown a lot recently. Their strength and their muscle development may not have caught up yet.
So what do you do? What do you do to help those kids with all the joint problems?
Sure. The first thing we do is, talk about why it's happening, and especially with the parents. And then we look at, what are their goals? Is this, a good time to take a break and step back from their sport and rest a little bit? Do we need to try to get them through the next 2 or 3 months and then they have a break? Or is this something that, it's uncomfortable, but it's not going to do any long-term damage, so it's okay to push through that a little bit more? And then based on that, we design a treatment plan, usually involving physical therapy. Sometimes we'll get, if they have a high school athletic trainer, we might try to get that person involved as well to ensure that they are able to compete at the level that they want to while not causing long-term damage to the best of our abilities.
Wow. So let's talk about arthritis, because that seems like something that starts to happen as we get older. How do we tell the difference between arthritis and maybe a joint injury?
Sure.
Or something else?
Yeah, x-rays are really the best way to look for arthritis. Arthritis tends to be kind of a long-term process. It slowly builds over time. So it becomes something that people will be like, oh yeah, it bothers me from time to time. Sometimes it swells up a little bit. And then over years, it gets worse and worse. Tends to be very stiff with certain activities or lack thereof. One of the commercials used to say, body in motion stays in motion. And that's true to a degree. We sit for a long period of time and get up on our knees kind of stiff. But seeing a doctor, getting some x-rays is a good first place to start to determine if there is some arthritis. Sometimes an MRI is needed to further clarify, but most of the time x-rays are sufficient.
And at what point do you go to the hip or knee replacement surgery?
That really depends on the individual. Certainly I have patients who come in and their x-rays don't look that bad, but their quality of life is severely impacted and they're not able to work the way they want to because they have a very physically demanding job, or they're not able to enjoy sports like golf or tennis, or even just walking around their neighborhood. And so those would be patients I would be more inclined to talk about, moving ahead with joint replacement surgery. And then others, I have, elderly patients who have terrible arthritis, but they have other medical problems, other health concerns that put them very high risk for surgery. So they may not be a good candidate. And we might be talking about other ways to manage their pain and symptoms without surgery.
Oh, wow. This is a big topic, Dr. Buckler. So we want to tell more people we want to tell people if they want more information to contact you, to contact Providence Medical Group, and we'll have a link to that information on our website at katu.com. Thanks so much.
Absolutely. Thank you so much.
And we'll be right back with more AM Northwest. Stay right there.